Happy Friday, everyone. Thank you all for joining us for this Restart Kentucky webinar series. I am Ashley Watts, President and CEO of the Kentucky Chamber of Commerce, and thank you for taking time out of your day to spend a little time with us. I am really excited about the webinar we have planned today that I will share more about in just a second, but I do want to remind you that we have a couple webinars scheduled for next week. We have one about technology in the pandemic with some of our member companies that will be participating on that. And then we also have an exciting one next Friday with cabinet officials from Health and Family Services, Dr. Stephen Sack, Dr. Eric Freelander, and a couple others that will talk about how businesses can best open safely to make sure that we're keeping employees, patrons, and all Kentuckians safe. So if you need more information about that, those are on our website, kychamber.com. I am sure you will also see emails about it, and those will be on social media as well. For those that maybe wanted to participate in this webinar and were not able to hop on, we do, of course, record all of these and post these on our website, kychamber.com, and on all of our social media channels as well. But I am really excited about today's webinar. During this pandemic, there are changes to every part of our life, as we all know, but I can't imagine more changes that have had to be thought of by other than the people that are on the screen right now, dealing with our higher education, our universities here in Kentucky. From switching to online learning to dealing with dorm life and of course athletics, there are a lot of changes that are going to be made, and I know all of you guys are up for the challenge. Even as of yesterday, there are more changes that have been announced. We heard for the first time probably in many years that UK and U of L will not play each other in football. And I will say, while I was hopping on this webinar this morning, I did make the decision I did not wear red or blue. I wanted to be kind of as impartial as possible because we're so happy to have all of you guys with us today. So I am going to introduce the panel and the moderator. Today we have Dr. Burton Webb, President of the University of Pikeville. We have Dr. Timothy Caboni, President of the Western Kentucky University. We have Dr. Eli Caplouto with the University of Kentucky, President, and then President of the University of Louisville, Dr. Neely Bendapudi. And moderating our discussion today, I'm so happy she was able to join us, is Elizabeth McCoy. She's CEO of Planters Bank in Hopkinsville, Kentucky. She is also a former Kentucky Chamber Chairman. She was, I think, formerly served on the board of Murray State University, and she is a current Board of Trustee member at the University of Kentucky. So she is very plugged in to higher education, our university system here in Kentucky, as well as the Kentucky Chamber and the business community across Kentucky. So thank you all for joining us. We're so happy to have you all. And with that, I will turn it over to Elizabeth.
Thank you and good morning. Thank you, Ashley. I'm delighted to be here with this august group of university presidents representing Planters Bank and the Kentucky Chamber, and thank you so much for inviting me. So before we wade into the deep end of the pool of what the fall is going to look like, and now that we have the spring semester in our rearview mirror, let's talk about what we learned in the spring that we're carrying to the fall, what we did right, and what we could do better. So Dr. Bendapudi, let's begin with you and the University of Louisville.
Sure. Thank you. Good morning. It's such an honor to be here with my colleagues. And I will say that spring was quite the test for all of us. Institutions of higher education, we are known for our deliberate processes, and we had to turn on a dime. And I'm so proud of my colleagues at the University of Louisville because we actually, I think, were among the first to say we are pivoting to an online education because we had the advantage of our researchers here who specialize in infectious diseases and work on it, who said, you've got to move quickly. The one thing that's different maybe is that while we pivoted, we never really closed. As many of you know, over about 40% of our students are Pell eligible. And that meant that for many of them, we are their home. So something that might be of interest to this group is that throughout the process, we actually took care of and had people stay here, about 2,700 students. So throughout the spring, their housing and dining and everything we had to take care of. So what is it that we learned that we would go forward? I believe we benefited from having a lot of people at the table. We had daily calls with about 50 leaders across the university because there was so much going on that I think we needed to do. In terms of going into the fall, there are lessons on how quickly we can move, the supports that we need to provide to our faculty, staff, and students. And I think for the fall, the big test for all of us will be really engaging our student body. We need to get to the point where all the things that we know are so crucial to good health that our students help us. I want to make it uncool to walk around with a mask, without a mask. You know, we need to say, you have to wear a mask, you have to social distance, because it's not just about you, it's about other people. I hope that was a quick overview. It's hard when we know there's so many people to pitch in.
Thank you. Dr. Webb, what about you? Do you want to comment on what the end of your spring semester looked like?
You know, I think what we learned was that the preparation we had put into place in the previous year and a half, with all of the training for learning management systems and the ability to pivot quickly online, that paid off in a big way. We were able to pivot very rapidly before our students even got back from spring break. Nobody really missed a beat. Most of our students complained that they missed their faculty members. You know, they didn't have the opportunity to spend time with them like we normally do. But I think we pivoted very quickly in that. And then, of course, since that time, we've had the opportunity to build a plan that's very comprehensive for bringing students back in the fall and making sure that we do everything possible to make them safe and healthy while they're here. So I think those things are probably the biggest lessons coming out of it. Like Neely, I'm very grateful to be here, to be included in this group. It's great to be with colleagues and, in fact, to represent the independent colleges that exist in the Commonwealth of Kentucky. So thank you for this opportunity.
Thank you. So let's talk about what the fall is going to look like. I'm the most familiar with UK's plan. So Dr. Caplouto, let's start with you, the process that you went through and what you expect your campus to look like in a very few short days, actually.
Sure. Thank you, Trustee McCoy. We, I think, like my colleagues, benefited from a big tent and a big table. We have an emergency operations center and system that we've used to deal with everything from bad weather to cyber attacks. So that process was expanded. We even had competition among ideas about what would be the best way to open. We challenged 3 groups. They were independent of each other to come up with the best ideas. We sent those plans out to the campus, got over 4,000 comments. We developed a playbook, since nobody had a playbook, and sent that out to the campus, another 2,000 comments. We revised that, and I think quite inclusively, democratically, came up with the best ideas and then started implementation. We always keep in front of us 4 principles: health, safety, well-being of our students. Second, we've got to continue our operations like Neely said. We've got too much research, patient care, education that has to continue in this. Third, we began early on, starting in March, thinking about returning to normal operations, although we knew that would be different. And an example of trying to learn from what we were in the spring, we called all 30,000 students, cataloged what they said to us, how could we improve our online education would be an example. And then lastly, which is the tough part, finances came second. Not really tough, but we spent a lot of money we didn't have.
Dr. Caboni, how about you? Let's have your Western perspective on what fall looks like.
Well, one of the things we've talked to the entire community about is for us to have some sense of normalcy. This year is going to look completely different than previous years. And so getting the community prepared for what we're all going to do together is where we spend a great deal of time. In the spring semester, I will say that we took advantage of the time to do things differently, not just in the classroom, but for the entire campus. So essentially reimagine every bit of our operations. And one of the things for which universities are not known as being nimble and quick. We're really great at pattern maintenance. And we've had to learn how to be uncertain and deal with uncertainty. We've had to work through challenges in a way that cannot be perhaps as deliberative as we'd like via technology. The last thing is that we wanted to give folks choice, our faculty and staff choice and our students choice. And so we've allowed our faculty to decide the modality in which they're going to teach. We've allowed our staff to have the flexibility to work virtually if necessary. And for our students, tried to give them as much choice as possible. If they wanted to be online, allow them to continue their education that way. But if they wanted to be in person, they have that opportunity as well. So about 2/3 of our instruction will be in person or hybrid, about 1/3 on the web. We're looking forward to having folks on campus. But as Neely said, this is something that's going to require every one of us. We've had thousands of folks working to bring an entire community back together. All of those folks now rely upon each individual. And so if there's one thing that folks hear from me in this, it's wear a mask, wash your hands, stay 6 feet apart.
So I'll stay with you, Dr. Caboni. Do you plan to test all of your students as they come back to campus?
So I know no other institutions are doing that. We have not. We're following the CDC guidelines. The idea for us, at least, is that when you take that test, there's some period of time between when you take it and when you actually might arrive on campus. We know there may be some asymptomatic spread that those tests are trying to deal with, but we're confident that with aggressive testing on campus for symptomatic folks, good contact tracing that we're doing in concert with Barron River Health, and making sure that every member of our community wears a mask and stays 6 feet apart, that we can keep this relatively controlled. Now, I will say this. We're not going to be virus free. None of us will be. We have to learn to live beside COVID. And that means that it's going to be in our communities, on our campuses, and we just have to be aggressive at stamping that out whenever possible. Aggressive contact tracing, testing for symptomatic folks and any other individuals who want or need a test, but making sure that we're realizing that when we come back, COVID is in every community where our universities are.
So, Dr. Webb, are you prepared to shift fully to online learning should that become a necessity for some reason?
Oh yeah, like Western and probably several others, you know, our faculty are prepared to teach face-to-face or online at any moment. In fact, we just had a conversation in my College of Arts and Sciences yesterday about the watchword for the year, which is flexibility. You know, at any given time, we're going to have students who enter quarantine. We're going to have faculty who enter quarantine or test positive and need to become isolated. And, you know, we've got facilities to be able to manage that. One of the things that I think is different about the University of Pikeville compared to the other state universities is this: we actually are nimble and quick. And so being a smaller institution, we can make changes on a dime and it works because I have a team of people who are willing to implement those things. And I'll give you just a couple of examples. Late in the spring, we were finishing out the semester teaching things online. And even by 6 weeks, we had several of our faculty and students who were expressing levels of fatigue from teaching purely online. So we made the decision at that point to shift all of our fall classes to 8-week blocks instead of a 16-week semester. In doing that, we can shift online quickly and we won't experience that same kind of fatigue from being out there online. At that point, we thought, since we're shifting to 8 weeks, we've been studying a long time, moving all of our textbooks to open resources. So we decided people are redesigning their course, this is the moment. So we shifted all of our textbooks to open resources. So there will be no textbook cost for students in the fall. Many of our faculty are going into the primary literature for their text instead of using the old-fashioned textbooks. What I've discovered in that process is that it's reinvigorated several of our faculty who had become a little too dependent on the materials provided by the textbook companies and are now re-energized as creative faculty members, just like they were perhaps 4 or 5 years ago, and that's been good. We are one of the campuses that is doing testing. We will require testing of all students either within 5 days before they arrive or immediately when they arrive. And we're considering doing more extensive testing throughout the year. Testing and contact tracing are really the only way we're going to keep this virus under control, particularly in the tight environments that we have on campus. So we've built our plan around New Zealand's plan in the fall, which is extensive testing and contact tracing, and we'll be working our way through that.
Thank you. So Lexington, Louisville, Pikeville, and Bowling Green, as well as the entire state, benefit from having students on campus. And I know this is a concern. Some of the questions submitted in advance were from those communities surrounding your universities. and how your students might be interacting with citizens and how the spread of COVID might be impacted by that. So I'll start with you, Dr. Webb, since I still see your face on my screen, to comment on how you feel your university will interact with the city of Pikeville.
Sure. So our planning process has involved the city pretty closely. In fact, just the other night, I was at a city commissioners meeting and talked to them about the plan that we have. We've been coordinating with the Pike County Health Department since the very earliest days of this process to ensure that our plan was able to layer quite nicely on theirs for the county. It's actually the main reason we're doing testing of all students when they come back. We want to be sure that we can tell our community we've brought people back who are safe and aren't going to impact the community in a negative way. Now, we brought half of our football team back early for some weight training and conditioning, and none of them tested positive. They were all clear. Since that time, we're monitoring all symptoms. We do temperature screenings and all the other things that the rest of you are doing. And then if we get any symptomatic folks, we'll test. We're actually considering randomized testing at this time to make sure that we capture as many of those positive asymptomatic spreaders as we can, because we think that will be important. We're advising our students to stay on campus as much as possible, to try not to wander into the community or even go to Walmart if they can manage that, because we think that they might pick up the virus there. It's as likely that they'll do that as spread it. And beyond that, what I've reassured the city council and others is, once students come, they are part of the community. It's not as though they're foreigners from outside. They are part of this community, and they help with the economic engine that drives this community, and they're part of the solutions. Our students volunteer thousands of hours, like the students at all of our other campuses do, in support of the community. So I think that's an important message to send, and we'll continue to do so.
Dr. Bendapudi, are you testing all of your incoming students, and how are you working with the city of Louisville?
I just said I would be delighted to speak, and I realized I was on mute. So both aspects I'd be happy to talk to. One is with regard to testing. We share the same concern that Tim said. We will have an opportunity for every single faculty member, staff member, student to get tested just right up as school begins. Because the problem with testing, as you all know, is I could get the test today, but then in the next hour contract it. And so I do think it's incredibly important that we don't just rely on the testing. So yes, we have that opportunity right as school begins, but much more important to me is how we will do contact tracing and how vigilant we will be with regard to the relationship with the city. And I want to thank the chamber. As a business person and a recovering banker myself, when I speak to chambers of commerce, I always say my people. So I have to say thank you to the chamber for supporting us in the co-immunity project. And I'll tell you how this all connects. With the co-immunity project, as you know, we've been testing all healthcare providers in Louisville. So not just in our system, but across, whether it's at Baptist or Norton, it's part of our effort to make sure that the infrastructure is there to take care of people when they fall sick. The second thing that we're doing through the co-immunity project is actually wastewater testing across the city. And why does that help? Wastewater, and I won't get into too many gory details, but even before you realize you have a symptom, wastewater testing will show us. We are doing those tests. Dr. Aruni Bhatnagar of the Christina Lee Brown Envirome Institute that we have here, we're doing testing twice a week throughout the city. And what that allows us to do is, where are the hotspots? We're bringing the exact same philosophy and perspective to our students. So we will be having random testing, stratified random sampling. As a market research geek, I like saying that. But in addition, we are also going to be doing wastewater random sampling. So to me, all of these efforts, and of course, we are really privileged to have one of 12 regional biosafety labs, that's a level 3. So we have those capabilities, and we fully intend to use it to support our students as well as the community. And as I said, 2,700 students have been here throughout. They never went away. So they've certainly been part of the community. But as a urban metropolitan research university in the largest city in the Commonwealth, we think it's really important that University of Louisville realizes that our roots are here, our reach is everywhere, but we are in the city, we're of the city, we're part of the city. So we've realized the responsibility that comes with it and the honor of that, frankly.
Well, Dr. Caplouto, I was in a meeting with you yesterday where you discussed the impact of the University of Kentucky on Fayette County in general. And I know that you plan to test all of your students. So can you talk about your relationship with your local community?
Sure, like all my colleagues, we do not exist on an island. Our fates are intertwined with our communities, and we owe each other all of our collective efforts to keep everyone healthy and safe. We employ about 25,000 people. According to labor data, there are 188,000 there were before the pandemic people employed in Fayette County in some form or another. 44,000 unemployment claims have been filed. We have really maintained our workforce. We pay occupational tax and a school tax. We end up paying probably 20% of the county's budget. So keeping ourselves safe and healthy at first, so that we are part of a vibrant economy and a thriving community is important. So we are screening all 30,000 students. And why do we do that? We're a global campus. We accept students from all 120 counties, 50 states, and 100 countries. We think it's good to have a level set, a baseline. We will do the periodic surveillance testing when needed and so forth. We secured all our own supply lines of this. We developed what I consider to be a modern public health system. We have developed our own contact tracing. We've hired 15 contact tracers. They'll integrate with the state. More than that, we have built a modern, using the Salesforce platform. So imagine this virus can hitchhike across campus in a second, just like it can hitchhike across the globe. So you've got to be more nimble than you can ever imagine. You can't use an old public health system that takes a name down on a piece of paper with a phone number and try to call and say, who were you with and where were you? So what do we have? Every day at the University of Kentucky, every employee, faculty, student using a Salesforce platform has to fill out a daily attestation. Do you have any of the symptoms? That same database is going to have information on your testing. We can see, for instance, if on one floor in one residence hall, you had 10 people who woke up in the morning and said, I have a fever. Boom. You jump on that kind of information. You can't wait 3 days. So we'll have a cycle of screening, testing, tracing, and we want to make safe being as easy as possible. If you have those symptoms that day, stay in your classroom because stay in your residence because nearly all of our classrooms make it possible for you to hear that lecture and participate in that lecture online through a two-way communication. So that's the sample of the approach we've taken. Every entity is different. So screening may not work and may be unnecessary for certain campuses. We just felt it was a deeper responsibility given the reach of all the students that would be returning here. We thought that was best for Fayette County and our surrounding counties.
So even just in recent days, the university has pivoted in their approach to how much in-person teaching there will be as opposed to in the classroom. So do you want to comment on what made the university pivot in their initial plan?
We always, in our planning, we use bookends of, let's plan. We started this back in April and May. Fully sort of traditional in person, although we already had some online learning then, or fully online. So we're on a continuum here. 2/3 of our classes that'll be offered will have some form of in-person instruction. It could be a hybrid, in-person and online. This residential experience, given the demand we have for it, given our retention numbers and all, people still strongly desire it. It offers something of value. So we have to deliver it in a different way, a safe way. So our pivot is certainly there, but we are working hard for that in-class experience. I've walked our classrooms now. We have moved 9,200 pieces of furniture in the last month to create those safe spaces. Lecture rooms have certain chairs blocked and so forth. You go in, you sit, you don't have to think about, am I 6 feet apart? The seat available for you is 6 feet apart. Person lecturing has the plexiglass there. We've done all those kinds of things as well.
Thank you. And Dr. Caboni, do you feel that your professors are comfortable with being back in the classroom, and sort of what kind of triggers would you be looking for before we would have to pivot back to a complete online semester?
Well, we allowed our professors to decide really for themselves in concert with their department chairs and their deans to figure out what modality with which they were most comfortable. And I'm confident that they made the choices for themselves and for our community. I will chime in on what Eli said. I think that not just for our students, but for our faculty and our staff, the in-person environment is something we all crave. The huge national experiment that we conducted on ourselves to work in isolation and through computers for 5 months, we're gonna feel what it feels like to return to in-person engagement in just a few weeks. I had my first meeting with 20 department chairs just a couple weeks ago. And you could feel in that room that people want to be near others. We're social animals, social creatures. And so for our faculty, while I know there is concern for all of us, none of this is without risk, but no choice that we make is without risk. They've decided based upon their individual situations that coming back and being in person and teaching with masks on, 6 feet away, protected by plexiglass, making sure we have good hygiene practices, that it's worth the risk to be able to engage with our students. And this is why. 1/3 of our students are low income and first generation. They need both the socialization and social integration that will help them with retention and to be successful, not just in this year, but in future years. We need to make sure that they have the experience outside of the classroom that is as important as that in-person experience delivered by faculty. And so we've spent a great deal of time thinking about how the residence halls engage with the classroom, how folks can half the time be in person, other half of the class in perhaps their dorm room or their apartment, and then they flip around in other days, making sure that when we need to be nimble, we can and move on a dime. But on the other hand, we also have to learn to mitigate and manage the risk that still exists for all of us. And so I think that the environment that we've created is as safe as you can possibly create. If I had a young person that I was thinking about sending to WKU, I would feel comfortable knowing that the institution had taken every step necessary to help ensure that young person's safety. And for our faculty and staff, the same thing is true. Welcoming the entire cohort of faculty who are going to be engaged in in-person instruction and our support staff and all the folks that make this place run back, we're ready for them to be here. To Neely's point, we never really shut down. We've had thousands of folks over the summer making sure that we prepared and got ready for this experience. We've had athletes working in our residence halls as the tip of the spear, helping us to figure out what testing looks like, how we keep that distance. We're ready for the whole community now to come back and join the thousands of folks who've been here during the summer.
So I'd like all 4 of you all to comment on how you feel this is impacting your enrollment. Are you concerned that people will take a gap year? So Dr. Caboni, let's just start with you on that.
We were already having a terrific year in first year recruitment. We transformed our scholarship program this year, tens of millions of dollars more invested in our students and that freshman class that we're bringing in. As of today, we're up 450 students year over year, the largest gain in our freshman class in over 20 years. And so those numbers are holding for us. We think that we're going to have a remarkable turnout in that first week of classes. But here's the challenge. We have to ensure the safety of all of those students. It's one of the reasons we're over communicating with parents, with families, with students, with our faculty and staff, open forums, social media, anything you can think of. We're using that channel to help folks feel comfortable about the environment that we've created. Here's the last part of this. Crises give organizations an opportunity to live their best values. And for us, WKU is a family. We are all in this together. Our first year students that are joining this family, we have an opportunity to show them what we are and what the best of our institution is, even though we lived through a challenge. And so we're looking forward to what will be a remarkable first year class on the Hill.
Thank you. Dr. Webb, what about your situation?
You know, I think I would echo a lot of what Dr. Caboni said. You know, our enrollment for fall, our projections are up, our registration numbers are up. Everything looks really good. I would add maybe a word of caution in the midst of that, though. I do understand what it is to be a nervous parent or to have nervous parents. And I think that we will all experience a certain amount of students who melt away. That's the term that we use in higher education for students who don't actually show up, who've registered. We'll see some of that. We're hopeful that it won't be a big number, just like all of the rest of us are. As a smaller institution, you know, numbers matter to us. We're tuition driven. We don't receive state subsidies. So, you know, it's a different ball game, which is why we're doing the same things that I'm sure all of my colleagues are, over communicating and using every channel that you possibly have to reinsure the idea that students will be as safe as possible here. And we're trying to mix that with another very important message, which means, you know, we will not be COVID free. I think we all know that. You know, there will be cases that emerge on campus, and the first response of every parent is going to be, gosh, got to get Johnny home. Well, if we can quarantine well, if we can test well, if we can isolate well, we should be able to isolate those kinds of outbreaks and get them away from the rest of the population, resuming normal life as quickly as possible. So that's the message. That's the message that we're sending, and I think it's pretty consistent that we're sending across campus. So right now, we look good. All of our residence halls are full. We're actually going to have to rent rooms across the street. We'll just have to see how it plays out in the last, 2 or 3 days.
Good. Congratulations on that. What about your situation, Dr. Bendaputi?
I would say that, again, like my colleagues, I am so excited about the fall and for the students. Our enrollments look just fine, but with the caveat, I'm always worried about making these proclamations because we need to make sure that the students are here on campus. But right now, we have not seen a drop. So we shall see. Again, in fact, numbers look really strong. I want to say a broader point about students here, if I may, because it's not just those of us who are on here now. I want you to know, wherever you send your kids in higher education in the Commonwealth, we're all doing these things, so I won't repeat it. Whether it's the physical distancing, making sure that our facilities are set up the way we need to, that we have testing, etc. I am concerned about students who may say, I'm gonna step out for a year, do a gap year, because we all know that keeping up is a lot easier than catching up. And I worry about if they take a year, especially those who are most at risk. And by that, I mean our first generation, low-income college students. That's a very strong concern for me because you know that economically, the best time to be in school is when the economy is not booming, right? This is the time you want to stay in school, get yourself positioned for what comes next. And Elizabeth, if I may, this is of particular concern to us because Education Trust, which is a group that studies trends in higher education, just came out with a report last week. They studied the 101 most selective public universities, and they ranked, which I'm proud of, University of Louisville is one of only 3 with equal access to Black and Latina students, and one of 2 where the Black student population is more than 10% of the student body. What does this mean though? These are the very groups that benefit the most by being in college because of technology, food, the housing situation, which are more conducive to the entire student experience. So wherever you're going, if you have a child, and I have many members of my senior team whose children will be on campus this fall, because that was the test to me. Those of you who have kids here, are you having them stay in the residence halls? Are you having them be part of it? And when they say yes, it gives me great comfort to know that.
Dr. Caplouto?
Yes, our enrollments remain very steady, strong. Unlike everyone else, though, given how quickly this virus can pivot and get ahead of its own, that can shake families up in their local community. They can look at our communities and, have concerns. I want to echo what Neely said. Someone said to me the other day after I went over our plan, gee, my child may be safer on your campus than at home. So these students are going to be somewhere, okay? They're in community. While they're in our community, one of the things I think we learned from the spring is how important a support network is. And I'm talking about students supporting one another too. That is a tremendous resource. So that's what we're trying to get back to, just as my colleagues have said, do it in a safe way. But I think people should feel good about sending their children to our campuses. And honesty is important here. There is not going to be a case-free environment. Right. We have a group, given their age and based on data, that the likelihood of something serious, even if they're infected, is quite small. What we all worry about is they're becoming spreaders. It's an opportunity for them to live in a world that we may be in for a while, to understand those responsibilities you have to the greater good. So I think it's an incredible time to find that meaning and purpose in life, to spend your life on things that'll outlast it, making those kinds of lasting contributions. And so it's a golden opportunity, much better than a gap year.
Elizabeth?
Do you feel like this all impacts the long-range plans for universities in general? And Dr. Bendaputi's on my screen, so I'll start with you.
Sure. By the way, I was just going to verify. So our AD and our CFO both have kids on campus, and they will be on campus this fall. Again, I say that because I want you to be reassured that we are taking care of what we're asking people to do is trust us with their young people. But please note what everybody said. No one here is guaranteeing that there will not be COVID on our campus, because we cannot guarantee that in any sector of our society, but we're doing everything we can to mitigate. So what will the long-term implications be? To me, I've always talked about higher ed as having, and certainly at the University of Louisville, are we going to be a great place to learn, a great place to work, a great place in which to invest? So I look at all three of those in terms of long-term implications. I would say that this has certainly shown us that we can be nimble. In 4 days, we took our entire campus online, completely online. So this is going to make us rethink, how do we structure our coursework? How do we build in maximum flexibility for all of our students, whatever their age, first time or degree completers, etc. In terms of how we work, I think this is creating a lot of interesting dynamics. For about 20 years, I've been saying the mantra, work is what you do, not where you go. Can we figure out a way to let you get your work done as effectively as possible? Still the human connection, right? Extroverts like me are really struggling being isolated, I can tell you, but that's true for everybody. We are social animals, as Dr. Caboni said. So we will have some work where we come together, but we need to think about, how do we build in, is it a shorter work week? Is it more flexibility in hours? So how we work, what we think about is changing. And certainly even in the world of invest, by that I mean not just the time and talent and treasure you all give us, but what do we do to deserve it, to prove it? I think there's an opportunity for all of us as leaders of higher education in the Commonwealth to demonstrate the value we bring, how we can be places that initiate best practices and showcase what we can do beyond our contributions to the economy and the health and well-being. So yeah, I think there will be implications, but I'm optimistic about what they will be.
Dr. Caboni, do you have a comment about that, the long range?
I do. For about 2 decades, we've been hearing about the demise of residential education in this country and how everyone is going to get their education online. It's particularly for universities. And I actually think this has done the opposite for that conversation. As much as we can do via the internet, as much as online education can deliver some education and do it in a way that's effective, there is tremendous demand for that in-person residential experience. And so for us as an institution, for me, it buoys my spirits because we're investing tens of millions of dollars on the south end of our campus to create a first-year village where young people can come, have a living learning community of 23 other freshmen they live with a faculty mentor, a peer advisor. And that's what they want. I have not had one student who emailed me or parent who emailed me and said, can we please repeat the spring semester? They want to be back. They crave what a total, complete educational experience looks like. So it's not just inside the classroom, it's the total, for us, WKU experience that we create. And I think that that's going to shape our conversation. It will change the way we teach. It'll change our instruction. You're going to see more flipped classrooms. Faculty who are not facile with technology will be able to use computers in a way that they haven't before. But at the end of the day, I think what is demonstrated is the great value in that in-person residential education.
It seems to me that higher education in general is a very collaborative process, and that would be something that is invaluable that could be terribly lost if we did not continue to have some in-person. You know, Zoom's great. I feel like I Zoom half my day every day with somebody or something. Is just not the same experience as being in the room with you and talking through whatever our issues are. So I agree with you wholeheartedly. So Dr. Webb, any comment from you on how you see a transformation in your campus over the long run?
You know, we'll still offer face-to-face classes. I think we're all committed to that. We think that that's the best model for instruction. But I agree with Dr. Caboni. I do think we'll see more flipped classrooms. I think we'll see more seamless use of technology across the campus, more flexibility for students who are athletes, for example, who need to be on the road traveling with their sport. They'll be able to reach out and be in class without physically being in class. So I think we'll see quite a bit of that. I think we're seeing this in the workplace too. We're seeing a lot of folks who are choosing to work remotely. I've seen some statistics that say anywhere between 50 and 80% of people, if they chose, would choose to work remotely. And so this just moves that back into the college experience. The one word of caution that I would say is all of us sitting around the table are, I think, over the age of 50. And we grew up with face-to-face. We love face-to-face. We enjoy that. Kids today in their 20s and teens are growing up like this. It's not face-to-face. And so for them, what's normal and normative for forming relationships is utilizing some form of technology. Now that doesn't mean face-to-face goes away, but it does mean that they're more facile, they are more skilled in doing certain kinds of things. And that fundamentally will change the way that we need to reach them and the way in which that we need to educate them. So we need to pay attention to all of those things while at the same time building those living and learning communities, because I really think that often, or what we might see in the future, is folks who want to come to our campuses to live and experience the college life, but for whom sitting in a classroom might not be the best way to learn. So that's an interesting twist that we might see.
Thank you. So before we went live this morning, we were talking behind the scenes about what fall sports is going to look like. So I want to pivot just for a minute. We now know officially yesterday that there's no Governor's Cup ball game going to happen. Still to be determined if Western will play Louisville. Let's start with you, Dr. Caplouto, as the chairman of the Southeastern Conference Presidents. Would you like to comment on what college sports might look like this fall, or what we hope they will look like?
Well, Dr. Bendapudi and I are going to meet in an empty stadium and play a game of Trivial Pursuit. We'll see if anybody's interested. And I'll ask all my other presidents if they'd like to come. We can have a tournament and see what kind of support we all get. Yeah, everything's so awkward and this year. I mean, what the Southeastern Conference tried to do, like nearly all the other conferences, is we recognize we're probably going to have disruptions. So you try to limit the different parameters one would have to live within. So remaining in the conference, if you have to pivot and change schedules and have a quarantine week and so forth, is a little easier. It gives you some better shot in completing a year and that looks as normal as possible. It starts, just like all my colleagues, health, safety, well-being of our student athletes. And I'd have to say, I'll bet my colleagues will reinforce this. Our student athletes are part of our first phase in coming on campus. To watch them adopt these behaviors to keep themselves and their teammates healthy and safe has been pretty encouraging. As I heard someone say when we talked about this aggressive testing, I've heard a student athlete say, I don't care if you test me every day. And, they've had that swab all the way up the nose a few times, as long as I get to play and participate. But we are giving every student athlete, with no concerns about their decision in terms of future implications, if you want to sit out a year and just continue your education, we're going to encourage you to do so. If you have concerns, if you have family members that you live with that you worry that you may put at any kind of risk, you come first.
Dr. Benaputi?
I can't wait for the Trivial Pursuit. I was worried what game he would suggest. I'm ready for you, Eli. I have to tell you, though, that being a member of the executive committee of the ACC, we're really benefiting by the fact that Dr. Julio Frank at Miami and others who are actually, this is what they have studied their whole lives, infectious disease and spread and health. I have been very, very impressed and happy to get their insights. So the regime, so it has actually been very good for the University of Louisville, because as far as our athletics is concerned, we have a tremendous medical team led by a physician at Duke who is, and our own, each of us has a representative on there, and we're trying to set the standard for how it would be. So I echo exactly what Dr. Caplouto said. We are so far extremely encouraged by the behavior of the athletes and how they're doing, but as always, they're students first. For me, that's the thing. They're student athletes, they're students first. And so we're doing everything we can to support them. Will there be fans in the stadium? I don't know. I mean, these are calls we have to make as we get close, but our number one priority is fostering the education of our students and allowing them to go on and do great things.
Dr. Caboni, any comment from you? I mean, at least we haven't followed the Ivy League and canceled the entire thing just yet.
Well, first on the Trivial Pursuit side, we've got a great esports team. I thought we might play Rocket League or League of Legends here. Sure. Different generation than the board game generation, perhaps. I do think that health and safety of our athletes is first. Conference USA, I also am on the executive committee of Conference USA, and we've tried to delay as long as possible to have as much information in front of us to be able to make our decisions. I think each league is making for itself its own call. And it's built around a whole set of issues, including the way in which other institutions will test, restricting and limiting travel, trying to figure out how partnerships work closer to home. And we're going to continue to have those conversations in Conference USA. For potential football matchups in state, all I got to say is, Neely, call me.
Dr. Webb, any other comments from you on fall sports?
You know, we're not an NCAA school, we're NAIA, and NAIA made a decision to move several of the fall sports into spring. We're expecting a decision on football today about what will happen with that. It does change the nature a little bit of what we're doing, and we'll just see what happens. You know, I do think that as someone, Neely was just mentioning, I am in fact a medical immunologist. I spent all my life studying these things.
Great.
And I really can't think of a sport that is more dangerous if there is a positive case on the team than football.
Mhm.
And it's simply because of the fact those guys are lined up, you know, 12 inches from each other and breathing very hard, even though they're outside, and then they're piled up on each other in addition to that. So testing in that context has got to be a part of what we do, probably even quarantine for those guys if we're going to compete. And that's not a bad thing, because we can provide great educational opportunities for our student athletes if we continue to move forward in that context. Having said that, there are other sports that there's no reason they can't compete. You know, Tim, I'll take on your esports team any day. I mean, we had the second scholarship esports team in the nation. We started that a long time ago, and we've been beating up on SEC and ACC schools for a long time. So bring it on, buddy.
Call me too.
Yeah, ready for that. And anytime we want to do Trivial Pursuit, oh yeah, yep, we're happy with that. But I don't think we get a big fan base, and that TV contract, I don't know.
So as I sit here this morning and listen to the four of you, I must say on behalf of the citizens of Kentucky, I could not be more impressed by the caliber of leadership in higher education in our state. And so on behalf of our citizens, we want to thank all of you. So we have a few minutes left. I want to give each of you an opportunity to make any kind of comments that you want to about your university and about anything specific to how you're addressing the pandemic or anything else. So I'll start with you, Dr. Webb.
You know, Eastern Kentucky sometimes gets a tough rap because we've had economic challenges for a long time. But right here in the heart of Central Appalachia in Eastern Kentucky, there is a beautiful oasis, and it's called Pikeville. If you've never been to Pikeville, you need to get in your car and make a drive over here for a couple of reasons. We have one of the lower infection rates in the Commonwealth of Kentucky. We've had some spikes lately, but that means right now I think we've got 40 active cases in the entire county. And it's a beautiful area. When you drive around the corner into the little horseshoe that is Pikeville, you'll see 9-story buildings, and that's not expected in Eastern Kentucky. They house our optometry college and our medical school, and we just have a thriving community here that's open and welcoming, where we've been able to do tremendous things. Like the other colleges, we serve primarily first-generation students. I believe last year our number was 67%, not just Pell eligible, but full Pell eligible. We run in the mid-90s for Pell eligible students. And those first-generation students have a fantastic chance of improving in SES. Last time I looked at that data, we were number 2 in the state for moving up 2 levels in the SES. So it's a tremendous place to be, and we're working very hard to create a campus that's safe and responsive so that our students can thrive while they're here.
Thank you. Dr. Caboni, you and your beautiful Western Kentucky University campus.
Well, we know that we have to get our economy going, and for South Central Kentucky, WKU is an economic engine and a driver for our community and the region. We need our students to come home, and we want to make sure that we not only remain a lighthouse to attract them to campus, but that we want to become even more of a magnet to keep them here to help elevate the economy. And given the GDP numbers we've seen from the second quarter, we have got to figure out how to live next to this virus so our economy can recover. There's one thing I want folks to hear, not just prospective and current students and families, it's this: wear a mask, wash your hands, socially distance, and go Tops.
Thank you. Dr. Benaputi, how about you in the University of Louisville?
Well, this is the start of my year 3, and my friend Eli keeps telling me that year 8 gets really easy. So I'm waiting for that. But I love being here, and I have to tell you that I'm so proud of the contributions that my colleagues at the university are making, not just in the education, the teaching sphere, but on research. Hopefully you've all been keeping up with all of the advances coming out of UK and UFL as the research universities in the region. I am also very excited. We've talked so much about the medical side of the innovations happening at UFL, but there are really interesting things happening on the engineering side as well, with masks, with nanofilters, where we might get reusable, washable masks that will have the same protection as an N95 mask. Unfortunately, it might be September before we are ready with those, but at some point that will be coming, and that will have an impact not just on us, but on all of you as business leaders who are ready to go to work and ready to serve customers in a safe way. So anyway, it's just a pleasure. And since Tim started it, go Cards!
All right, let's have some Go Cats, Dr. Caplouto.
First of all, I want to express gratitude to the Chamber for your leadership. And also, I think all of you represent your communities. And I think you should be very proud of what we like to say we need to be, and that is the University of, for, and with Kentucky. We feel a statewide responsibility. It's why in the last few years, with no increase, in fact, sort of decreasing budgets, we opened full four-year medical school in both Northern Kentucky in partnership with NKU, and in Bowling Green in partnership with Western Kentucky University. Those collaborations are going to be important. We are grateful for our tax dollars, and we get about $250 million. $80 million goes out to extension centers and other mandated programs that serve the agriculture area and all. But we take those remaining dollars and leverage it into a $4.4 billion enterprise that does good, but also is an economic engine in many ways. And the discovery and innovation, $450 million of research that we go out and compete for and earn and bring into our economy that's used throughout the state. And it does those creations, as Neely indicated, that can turn into intellectual property and be marketable. But we're also one of those 4 states, because of our university and the many partnerships, that got over $80 million grant to reduce opioid deaths by 40% in 3 years. So we want to be and work hard every day to honor the commitment Kentuckians have made to us.
Thank you. Well, I want to thank you all, Dr. Bendapudi, Dr. Caplouto, Dr. Webb, and Dr. Caboni, for taking your time out this morning. I hope that everybody that's listening to this appreciates the degree of planning that has gone into what our fall semesters are going to look like at our universities, and we will charge you to take good care of our students. So thank you all so much.
Thank you so much.
Thank you.